Well, welcome back. The teen you see right behind me just wants to be normal. Physicians say his extreme weight is a ticking time bomb, but doctors can't perform the bariatric surgery he needs because insurance just doesn't cover it.
I really don't want to die young, so I'm going to try my best to do it. I want to live for a long time.
Tony King is in the fight of his life. His doctors say he is morbidly obese.
I weigh about 415 right now.
Doctors say Tony has high blood pressure, severe sleep apnea, and pre-diabetes.
One of my goals is to lose this weight, try to get a job, and get my way through college.
For now, this 15-year-old Meadowdale freshman is just trying to get by. Tony says other students stop, stare, and make fun of his weight.
They'll talk about that fat kid and all that. Man, why is he wearing this like that? Overweight kid and something like that.
These comments break his mother's heart.
Well, I'm really hurt, and I mean that I'm really hurt because I thought about his first day in high school, where when we walked in, the kids, they didn't know Tony, and they just, excuse me, they just start laughing at him. They don't know him as a young man. He's sweet. He's never gave me a bit of problems.
Growing up, Tony was always a little bit bigger than the other kids his age. Now, his shirts say 5X. He struggles to slip his feet into his gym shoes. His mom told me they've tried just about everything to help Tony lose the weight.
Tony done been on so many diets, and me and my husband even went on them with him to give him that support. But we figured if he could have that surgery, and that'll get at least 50 pounds off.
Doctors referred Tony to Cincinnati Children's Hospital and Dr. Thomas Inge.
In Tony's case, he really did have and does have those kinds of health problems that we see in a 50 or 60-year-old who's been obese for decades and decades.
Dr. Inge has operated on hundreds of obese children at Cincinnati Children's since 2001. He believes Tony's weight, if not controlled now, will put the teen in an early grave.
And ultimately, for black males in particular, he stands to lose more than 20 years off of his lifespan.
Dr. Inge put Tony on a strict regimen designed to prepare him for weight loss surgery. Tony tracked how much he ate, lost at least 15 pounds, and talked to psychologists. Dr. Inge said Tony completed the program with flying colors. Tony's doctor and parents thought he was ready for the procedure. This email from Dr. Inge's staff says United Healthcare gave them pre-approval in early 2008. Everything seemed to be on track to help rescue Tony.
Children submitted his paperwork into my insurance company, which is United Healthcare, and they kept it from November to January the 1st and did not notify me of any changes.
Dr. Inge says he also wasn't notified of Brenda's policy change that took effect on January 1st of 2009. Now United is refusing to pay for Tony's surgery because it isn't part of her coverage. Brenda was devastated when she learned that surgery would require her to pay $30,000.
I can't afford to pay all that I've been paying, but I have to pay a little bit at a time. If it's to help him be able to live longer, then I don't mind.
Dr. Inge appealed to United Healthcare.
And the hospital and doctors are doing everything right to try to provide services to these deserving patients. And sometimes the insurance companies are difficult to navigate the changes.
It's a hard lesson for Tony, who wants to be a doctor himself one day. Still, he is determined to inspire other obese children.
I want to show other kids if they ever be like me one of these days, don't just give up, don't just sit at home and do nothing, just let all this weight get to you, just die right there.
Right now, Tony is still in limbo. His family is hoping for a miracle with the insurance company or Brenda's employer. United Healthcare contacted me today, and they told me there is specific wording in the customer certificate of coverage that says the following services are not covered: surgical and non-surgical treatment of obesity, including morbid obesity. Our records show that this employer has not had morbid obesity coverage since they became a customer in 2004.
So, Kenan, I guess the question then that needs to be asked is, then were they pre-approved in 2008?
Right, exactly.
Yeah, and that's a very good question. And, you know, they tell me that they did not give any record or pre-approval. United
UHC.
Healthcare
Okay.
did not give any approval to the hospital. If they would have given that approval to the King family, but they didn't do that either. And so right now, Brenda says she's going to continue to fight those appeals, get those appeals out there, and fight with the insurance company and work with her employer to see if she can get this surgery for her son.
Hopefully they can get it figured out.
And hopefully they'll keep us posted.
Yes.
All right,
Okay,
Kenan,
thanks.
thank you.